Hi guys, welcome back. So this is the second part of your topic, blood group and blood transfusion. Okay, it is a PBL as well as a short note. Okay, so what is erythroplastosis fetalis? It is it comes under RH system. RH system of blood transfusion. So it is like a disease of neonates and which RH incompatibility. There is agglutination and destruction of the fetal red cells. In these conditions, the mother is RH negative and the fetus is RH positive. So we need to know the mother is negative and fetus is RH positive. Okay, and there is no complication in the first pregnancy, but problem occur in subsequent pregnancy. So first pregnancy, in first pregnancy you don't have any problem, but subsequent pregnancies you do have a problem. Why does this occur? Because if an Rh positive baby is born to an Rh negative mother, then some fetal erythrocytes, like these are your RBCs, some fetal, these are fetal means they are Rh positive, they will enter in the mother during childbirth, like pass to the mother during childbirth. This produces anti-D antibodies, like anti-D antibodies to the mother, anti-D antibodies to the mother. Now in the next pregnancy, the fetus is Rh positive. These antibodies from the mother destroy the fetal erythrocytes, leading to hemolytic disease of the newborn. What are the clinical features? Clinical features are very important. Clinical features are, first of all, the fetus is jaundice. Fetus has jaundice and is anemic. Okay, the liver and spleen are enlarged. That is hepatomegaly and splenomegaly. Easy. Now the increased concentration of bilirubin in the brain tissues can damage the nerve cells, leading to, now you know that it is related to the liver. So bilirubin must be in high amounts. So this bilirubin will uh, go in the brain, and tissue damage can occur in the nerve cells, leading to kernicterus in a severe form. It presents as hydrops fetalis. You will learn this in your biochemistry, or I will, if you ask me in the comment section, and then I'll surely make a video on it too for you folks. Okay, treatment, like first of all, prevention. Erythrosis fetalis can be preventing it by administration, anti-D antibodies to the mother. Like anti-D antibodies to the mother can begin soon after the first child is born. This causes destruction of Rh positive fetal cells in the maternal blood. Easy. Okay, now the treatment. What's the treatment of erythroplastosis fetalis? Treatments, it's easy. Like it is treated by replacing, now whole of the blood is can undergo hemolysis. So we will replace few amounts of blood, like small volumes of blood, like 400 ml in the first few weeks, repeatedly during the first few weeks. After 400 ml is infused, and at the same time an equal amount of Rh positive neonatal blood is removed. Okay, this procedure needs to be repeated several times during the first few weeks of life. Easy. So this was your erythroblastoma fetalis. Now we'll start with blood transfusion. Okay, what is blood transfusion? So blood transfusion is a procedure. It is a simple procedure in which blood collected from your donor and transfused to the blood recipient. Easy. Now this was our definition. Now your why is it done? Like what are the indications? Okay, what does it indicate? Okay, sudden blood loss. In RT is road traffic accidents. There is sudden and large volume of blood is lost by the person. No, then we need to in such conditions transfuse the blood to the recipient. Okay, during major surgeries, if there is like in major surgeries, if any important vessel is cut and a lot of blood is lost, then we need to replace that volume of blood. So blood transfusion can be used as a technique, as a surgical procedure. Okay, then patients with bleeding disorders such as bleeding gums, or like piles, if the person has lost a blood of major volume of blood during through defecation. Okay, during the defecation, sorry. Okay, then patients with severe burns. Okay, or patients with severe anemia, then I'll write it down: burns, anemia. I'm not writing it whole so that your time is not wasted during in this. You can just written and make your own notes and study those notes only before examinations, as your notes are the most important. Whether you mark in your Venkatesh Semmalingam, no worries, but you should mark in your textbook. If you can't write it separately in the book, it's also very much fine. Okay, now patients with severe anemia, thalassemia and leukemia, or hemolytic disease of newborn. Okay, such as, like now we just saw erythroplastosis. erythroblastosis fetalis, extremely sorry. Okay, then how do we collect and store blood? Okay, so first of all, blood is collected from healthy donor. What is healthy donor? Healthy donor means he should not be anemic, first of all. Okay, if he is anemic, then what is the use of donating he or she donating the blood? Okay, or it should be free from STDs like HIV, hepatitis, syphilis, and other diseases like malaria. Then it is collected under strict aseptic precautions. Okay, aseptic precautions are very necessary, and it is from the antecubital vein. We know all that antecubital vein near the cubital fossa. It's easy, like anterior aspect of your elbow joint. Okay, into a collecting bag mixed with anticoagulant. Obviously you need to anticoagulant such as histamine or acid citrate dextrose. Okay, then 1 unit of blood. What is 1 unit of blood? 1 unit of blood is 420 ml of blood. You should be remembering this. It is very important. 420 ml of blood is collected. Okay, and it has stored. It has like it can be maximally stored within 3 weeks. Like its shelf life. Okay, from the time of collection. Okay, and it's stored at 2 to 4 degrees Celsius in a blood bank. You have blood bank in your medical college, or if you don't have, no worries. You must be having in your cities and stuff. Okay, then or major hospitals. Okay, then. What are the precautions taken? They should be taken during blood transfusion. Okay, first of all, the temperature of the blood should be transfused must be like temperature. First is temperature. Second is aseptic conditions should be maintained. Third is the transfusion must be very slow, or else it would rapid infusion can lead to excessive load on the heart, like heart pumps the blood and hence resulting cardiac failure. Okay, now what are the different hazards of blood transfusion? I will show it in my textbook only. You can refer to this hazards of blood transfusion table in this Venkatesh textbook. It's very written in a very easy form. Okay, what are the hazards? Okay, first of all, if the blood group is matched or it is mismatched. Okay, what are the complications? Okay, so the complications are if it is matched, then immediate and delayed. Immediate it is circulatory overload, shock. Circulatory overload happens when you transfuse the blood very rapidly, infuse the blood rapidly. Hyperalkalemia, hypercalcemia, pyrogen reaction, shock, and in delayed transmission of disease such as we just read it right now. It's just given in the same thing only, same stuff is only given. Okay, and then delayed may we can write jaundice, immediate mismatched is hemolysis, shock, renal failure. Okay, this was it. Okay, and I want to request you people one thing, like I am teaching you guys all this stuff. Like I have just completed my universities and teaching you guys all the important topics. I will be keeping on doing it even in my second year. But I'll request you one thing, like please, it's okay if you don't like my video, or even you don't share my video. It's all right, but just do two things. First, comment in my video. Why am I telling you this? Very very simple. I'm making a lot of mistake. I know I'm a beginner, but you must tell me where I am making mistake. Like take a few seconds off of your schedule and just tell me that this you are making, so don't do it next time, or make a topic on this video. So please do it. Okay, it would be very very helpful for me. Thank you. Bye.